skull is really nice though. Cool skull.
Yes, pretty cool. Go on.
Alright. The methods of the study of the skull. So a study of the skull can be done from the outside in different views. So अगर superior view देखते हैं, that's the Norma verticalis. अगर posterior view देखते हैं तो उसको बोलते हैं Norma occipitalis. This is the occipitalis. Anterior view देखते हैं तो Norma frontalis. Lateral view देखते हैं तो Norma lateralis. और basal वाला view देखते हैं तो Norma basalis. ठीक है, तो कौन सा एक तो हो गया? Norma frontalis, Norma verticalis, Norma occipitalis, Norma lateralis and Norma basalis. And also the whole skull can be studied from inside or internally by removing the roof. Like this roof was removed and
Which is not a part of the same skull for some reason.
Magic. And internal surface or the cranial vault, this is the cranial vault, and internal surface of the this base we can see here. So this is the anterior, middle and posterior cranial fossa.
Yes, ma'am.
Okay, now basically start with the Norma verticalis. Norma verticalis ये है, इसमें भी है, और इसमें क्या है? When viewed from above, it is usually oval. You can see it is oval in shape. Oval है. It is wider posteriorly. You can see this part. If you will notice that this part is छोटा and this part is बड़ा. So it is wider posteriorly than anteriorly. The shape may be nebully circular, that's not important. Bones seen in the Norma verticalis, you see the upper part of the frontal bone. You see the uppermost part of the occipital bone, just itna wala part दिखता है occipital bone का. Or you see the parietal bones on each side. Cool. Now sutures. There's this coronal suture, anterior posterior जो divide करता है between the parietal and
parietal and the frontal bone.
The second suture is the sagittal suture. Coronal suture is the तूने क्या बोला था?
Serrate.
Serrate suture. Sorry. Sagittal suture. It's placed in the median between the two parietal bones. Then you have the lambdoid suture, which is
Denticulate.
Yeah. So this was serrate. This is denticulate. This is between the occipital bone and the parietal bone. Now there is metopic suture, which is only present in 3 to 8 individuals.
3 to 8%.
3 to 8% individual, lies in the median plane. मतलब इधर कहीं, and separate to two halves of the frontal bone. मतलब इधर ये जो frontal bone है इसको separate करता है. It's present only 3 to 8% of the individuals, known as the
Metopic suture.
Normally it fuses after 6 years of age. Alright. Now some other features of Norma verticalis. The highest point of the sagittal suture is the sagittal suture because it divides into left and right. So this point is known as the vertex. The vault of the skull is arched roof for the dome of the skull is arched for the dome of the skull. Bregma is the meeting point of the coronal suture and the sagittal suture. So this point is bregma.
यहाँ पे anterior fontanelle होता है.
हाँ, anterior fontanelle जो close होता है 18 months में. फिर the lambda is the meeting point of the sagittal suture and the lambdoid suture. So this is the sagittal suture, lambdoid suture. इधर lambda होता है, इधर posterior fontanelle होता है जो close होता है 2 to 3 months में. So ये हो गया. Now उसके बाद है the parietal eminence. The area of maximum convexity in the parietal bone. ये जो दिख रहा है ये convexity. This is the parietal eminence. It is the common site for fractures. Okay, parietal eminence. Then you have the parietal foramen, one on each side. Okay, parietal foramen which is present on one on each side, which is very clearly seen here, if you can see, on each side. Parietal foramen.
It transmits the emissary vein.
Emissary veins of the scalp into the superior sagittal sinus. ये sagittal suture है तो superior sagittal sinus, and you should always remember that this is 2.5 to 4 centimeters above the lambda. So this is the lambda, which is the junction for the junction of sagittal and occipital. Occipital neither sagittal and lambdoid suture. So this is the parietal foramen, which
transmitting the emissary vein.
Parietal emissary vein from the veins of the scalp to the superior sagittal sinus. Important. Then the oblion is a point of the sagittal suture between the two parietal foramina. So this point between the two parietal foramina, we'll call it as
oblion.
Now we'll talk about this temporal lines, which can be seen here but not that clearly. So we'll see it in the diagram. The temporal lines begin at the zygomatic process. Okay, so this is the zygomatic process of the frontal bone.
The upper part.
This upper part. This is the zygomatic process of the frontal bone. Now they arch backwards and upwards and cross the frontal bone and the coronal suture, and and coronal suture and the parietal bone. Over the parietal bone there are two lines. There's this superior line and there is this inferior line. So traced anteriorly they fuse to form a single line.
And posteriorly the superior line fades out and you can only see the inferior line, लेकिन इसमें दोनों दिख रहे हैं. ठीक है.
तो मतलब ये superior temporal line है और ये inferior temporal line है. ठीक है. Now the clinical anatomy which is important. First of all, fontanelles we know there are two important fontanelles. फिर उसके बाद अगर they fuse early, which happened in the case of Rishika, she believes, brain growth is stunted, so such children are less intelligent. And if,
My fontanelles closed up early, so I'm less intelligent.
Okay. And if anterior fontanelle is bulging, there is raised intracranial pressure. Or if anterior fontanelle is depressed, it means that there is decreased intracranial pressure. It's due to dehydration.
Caput succedaneum is
It's a soft tissue swelling in any part of the skull due to rupture of capillaries during delivery, and it becomes normal within a few days. Okay. Now we'll talk about Norma occipitalis.
next video.